I'm Professor Andrew Taylor. I'm the Professor of Cardiovascular Imaging here at UCL, and I'm also the Divisional Director of Cardiorespiratory Services at Great Ormond Street Hospital for Children. One of the projects that we want to do that will link UCL and Great Ormond Street, so link engineers and clinicians, is to build a model of the mitral valve. Now, over the last decade, the treatment of valvular heart disease has been transformed by the use of percutaneous devices. Such devices exist for the pulmonary valve, which connects the right heart to the pulmonary artery and the lungs, and the aortic valve, which connects the left ventricle to the aorta and the systemic vasculature. Nothing really has been brought forward for the mitral position, which is very, very complex, and so this project will link imaging data that's acquired with MRI, CT and echocardiography and develop an in silico model of the mitral valve for us to begin to design and develop new mitral valve treatments. So I'll hand over now to Silvia Schiavano, who will give us a little bit of an overview of the engineering aspects and modelling aspects of this project.
I'm Silvia Schiavano. I'm a senior lecturer in biomedical engineering at the Center for Cardiovascular Imaging, which is based both at UCL and Great Ormond Street Hospital for Children. From an engineering perspective, it's very important to understand what are the requirements to design an optimal device that could work for a long time in the heart, especially in this challenging position. Therefore, we are planning in this project to try and use different imaging modalities, such as three-dimensional echocardiography or magnetic resonance imaging, CT, which are conventionally used to assess the patients, and combine the information from all these different techniques in order to create a model which represents the patient's heart. We will use this information, which is quite challenging to integrate together, in order to then test different devices on a computer and try and optimize in a first step the design using these techniques. As basic scientists embedded in a clinical department, we have a great advantage of having access to loads of information, both from a clinical perspective and an engineering and imaging perspective, and we will try to combine these in order to take forward this project.